folks. This afternoon's topic C. These 7 mistakes show up again and again in research on anxiety, Alzheimer's disease, and long-term cognitive decline. And the powerful thing is that every one of them is modifiable. Addressing even one can shift the trajectory of brain health, emotional resilience, and day-to-day functioning, whether you're in Pennsylvania or anywhere else. 7 mistakes and why they matter with deeper context. 1. Social isolation and loneliness. Loneliness isn't just a feeling, it's a psychological stressor. Large pooled analysis show that people who feel lonely have about a 31% higher risk of developing dementia. Isolation reduces cognitive stimulation, weakens emotional resilience, and increases inflammation and stress hormones that affect the brain. Action: rebuild connection in small, sustainable ways. Join a library program, volunteer, attend senior center lunches, or schedule weekly calls. Even 1 or 2 meaningful relationships can buffer cognitive decline. 2. Chronic sleep disruption. Sleep is the brain's nightly housekeeping shift. During deep sleep, the glymphatic system clears metabolic waste, including amyloid proteins associated with Alzheimer's. Fragmented or short sleep disrupts memory consolidation and increases long-term cognitive risk. Action: aim for 7 to 9 hours. Keep a consistent sleep-wake schedule. Reduce late night screen exposure and talk with a clinician if you suspect sleep apnea, which is strongly linked to cognitive decline. 3. Physical inactivity. Movement is one of the most potent brain protective tools we have. Regular aerobic activity increases blood flow to the hippocampus, the memory center, and stimulates neurogenesis, the creation of new neurons. Strength training supports metabolic health and reduces vascular risks, which is tightly tied to dementia. Action: target 150 minutes per week of moderate activity plus strength work twice weekly. Walk in social parks. Join community fitness classes or use indoor options during Pennsylvania winters. 4. Smoking. Smoking accelerates vascular damage, reduces oxygen delivery to the brain, and increases inflammation, all of which raise dementia risk. It also compounds anxiety and disrupts sleep. Action. Explore cessation programs, nicotine replacement, or primary care support. Quitting at any age improves brain and cardiovascular health. Regular heavy alcohol use. Alcohol affects memory circuits, attention, and brain volume. Heavy or frequent drinking increases the risk of anxiety, sleep disruption, and long-term cognitive decline. Action. Follow low-risk drinking guidelines and talk with a clinician if cutting back feels difficult. Even small reductions can improve sleep, mood, and cognitive clarity. 6. Prolonged stress, anxiety, and untreated depression. Chronic stress floods the brain with cortisol, which over time can shrink the hippocampus and impair emotional regulation. Untreated depression is one of the strongest midlife predictors of later cognitive decline. Action. Use evidence-based strategies like CBT, mindfulness breathing practices, or therapy. Meditation can be appropriate and effective when needed. Reducing stress is not an indulgent. It's neuroprotective. Untreated hearing loss, and low cognitive engagement. Hearing loss increases cognitive load. The brain must work harder to decode sound, leaving fewer resources for memory and thinking. It's also linked to social withdrawal, which compounds risks. Low mental stimulation accelerates decline. Action. Get hearing checked regularly. Use hearing aids if recommended. Engage in mentally stimulating activities, puzzles, reading, learning, conversation, music, or community classes. Quick decision guide. Start with the big 3: social isolation, sleep, and physical activity offer the broadest, fastest benefits for both mood and cognition. Seek clinical support when you notice new worsening memory issues, persistent insomnia, heavy drinking, or mood symptoms. Primary care providers or memory clinics can help with evaluation, and planning. Risks, trade-offs, and limitations. Correlation versus causation. Lifestyle changes reduce risk but don't guarantee prevention. They shift probabilities in your favor. Vascular health matters. Hypertension, diabetes, and obesity interact with lifestyle factors. Managing these with a clinician strengthens brain protection. Source and further reading. Alzheimer's Association, Dementia Risk Reduction. Nature Scientific Reports, Lifestyle Factors and Cognitive Decline. National Institute on Aging, Loneliness and Dementia Risk. Newsbreak Summary and Clinical Commentary. Options and simple sleep reset checklists. Ready for caregiver, families, or community education. Give me 1 second, guys. Okay. Now, the second part of this is the 2025 Alzheimer's Disease Facts and Figures Report. Reveals a nation at an inflection point. An estimated 7.2 million Americans aged 65 are living with Alzheimer's dementia. In 2025, with cost of care reaching 384 billion, and the trajectory points sharply upward without major breakthroughs. Below is a deeper, more textured explanation of the findings you requested, designed to give you not just the numbers, but the story they tell about aging, caregiving, equity, and the future of dementia care in the U.S. The big picture, what 2025 looks like. The Alzheimer's Association's 2025 report paints a vivid portrait of a country grappling with the consequences of longevity, chronic disease, and sustained care infrastructure. The 7.2 million Americans living with Alzheimer's today represent the largest number ever recorded. And demographic momentum means this figure will continue to climb without disease modifying breakthroughs. 13.8 million Americans could be living with Alzheimer's by 2020 or 2060, a doubling that will reshape families, communities, and the national economy. Prevalence and demographics. 1 in 9 adults age 65, 11% has Alzheimer's or dementia. 74% of people living with Alzheimer's are 75 or older, reflecting the steep age-related risk curve. Women continue to bear a disproportionate burden, comprising nearly 2/3 of all cases. Mortality trends. Alzheimer's disease remains one of the nation's most lethal conditions. 120,122 deaths were recorded in 2022. Alzheimer's is now the 6th leading cause of death in the US, and its mortality rate has risen 142% since 2000, even as deaths from stroke and heart disease have declined. This rise reflects both improved recognition and the reality that more Americans are living long enough to develop neurodegenerative disease. The human cost caregiving in 2025. Behind every statistic is a caregiver, often a spouse, adult child, or close friend whose life is profoundly reshaped by dementia. Nearly 12 million unpaid caregivers support people living with Alzheimer's or other dementias. They provide 19.2 billion hours of unpaid care annually. The economic value of this unpaid labor is estimated at 413.5 billion, a figure larger than the GDP of many countries. Caregivers face elevated risks of depression, anxiety, chronic illness, and functional strain. The report emphasizes that caregiving intensity is rising, even as the number of available caregivers per older adult declines. Economic and system level impact. The financial footprint of Alzheimer's is staggering. 384 billion in total payments for health care, long-term care, and hospice for people 65 plus with dementia in 2025. Medicare, Medicaid bear the majority of these costs, with dementia care costing significantly more per person than care for older adults without cognitive impairment. The report warns that without systematic reforms, workforce expansion, home and community based services, and equitable access to early detection, costs will continue to outpace capacity. Early detection and public attitudes. The 2025 special report highlights a major cultural shift. Nearly 4 in 5 Americans want to know early if they have Alzheimer's, even if treatments are imperfect. People value time to plan, access to emerging therapies, the ability to participate in decisions about their future. This aligns with your own interest in early detection and prevention, an area where public demand is now outpacing system readiness. What this means for Pennsylvania. The national report includes state level tables for prevalence, mortality, caregiver counts, and economic impact. Pennsylvania consistently ranks among the states with the highest number of older adults living with dementia, reflecting its age distribution. Pennsylvania's 2025 prevalence, state specific death rates, caregiver burden, and economic value, projected growth through 2060, implications for Meadville's aging population and care infrastructure. Okay. Practical takeaways for your work. Given your deep engagement with dementia care, behavioral science, and caregiver empowerment, these findings reinforce several priorities. Invest in early detection pathways. Public demand is high, but access is uneven. Expand non-pharmacological, dignity-centered care models, especially as caregiver strain intensifies. Advocate for workforce development. The report highlights shortage across every segment of dementia care. Support family caregivers with practical tools, respite pathways, and culturally adaptive education. Okay, guys, that is your C for this afternoon. I will jump on in a bit after a break for D. Until then, Gator Wellness, take care, folks.